Let's take you to the US now, where COVID-19 cases and deaths have been rising in the past few weeks. With vaccination rates plateauing, there's now a debate over whether all Americans should receive a booster jab. For the first time since February, the US daily death toll from COVID has surpassed 2,000. Now, according to the Center for Disease Control, Alabama and West Virginia are the two states with the worst death rate in the country. Almost 2/3 of Americans have now received at least one dose of the vaccine. But after being one of the world leaders in vaccine uptake, the US has now dropped to the lowest rate in the G7 countries. 55% of the US population has now been fully vaccinated. Let's take you live to Maryland to speak to Anthony Fauci, Chief Medical Advisor to President Biden. Good to see you, Dr. Fauci. That's quite worrying, some of the things I've just been explaining to our audience. Add to that the fact that we're going to see perhaps 200,000 cases a day in the coming weeks. What's gone so badly wrong?
Well, the problem is that we have still in this country, unfortunately, although we've done relatively well with the vaccination program, we are in a situation now, we have about 70 million people in the United States who are eligible to be vaccinated who have not gotten vaccinated. We've really got to get to those people to get them vaccinated because that propagates the outbreak. Fundamentally, this is an outbreak of the unvaccinated. Certainly, there are breakthrough infections among vaccinated individuals. Most of them, overwhelmingly, are either asymptomatic or minimally symptomatic. But the deaths that you just mentioned and the hospitalizations are fundamentally among those people who are unvaccinated. So it really is so unfortunate that we have enough vaccines to give to everyone, and yet there's still a substantial proportion of people in that unvaccinated group who are really very much at risk and propagating the outbreak in this country.
So the messaging around the vaccine is clearly not working. Does there need to be a new approach, a new way of tackling vaccine hesitancy?
Well, certainly we want to continue the outreach in a positive way to get trusted messengers in the community to try and get people to understand the importance for their own health, for that of their family, but also their community responsibility. But you reach a point where you have to do something more than that, and that's what President Biden is doing with mandates of some sort, varying levels. For example, in their businesses and corporations that have 100 or more people, that now those individuals have to either get vaccinated or get tested. That's the first thing. The second thing is that there's a vaccine mandate for people who are in the federal government employees in the executive branch, as well as anyone in the health system who relies on Medicare and Medicaid. So those are just some of the mandates, as it were. The problem that we're having in the United States is that locally the governors are pushing back on mandates and are suing to prevent us from doing the mandates. But we believe strongly that at the federal level, what the president has done is entirely legal.
Would you like to see the mandate go even further, perhaps to travel and to smaller businesses as well?
Well, that's on the table. I mean, what I think you're going to see is, first of all, what the president has done with regard to travel. There's a problem of some people traveling don't want to wear masks. Well, now if you don't wear a mask, the fine for that will double. Whether or not requirement for vaccination is going to be across the board on travel is on the table. It's being discussed, but nothing has been decided. Now that we have vaccines such as Pfizer that's fully approved with the stamp of approval, a number of local businesses are clearly going to be mandating, saying that if you want to go to this business, you want to work in this corporation, or even what we're seeing a lot of now, if you want to attend this university or this college, you've got to show proof of vaccination. So we're going to be seeing more and more mandates at the local level.
Can you clarify for us what is happening this week potentially around the booster shots?
Yes, the advisory committee to our regulatory agency, the Food and Drug Administration, has recommended boosters for people who've received the Pfizer 2 doses, the prime followed in 3 weeks by the boost, to within 6 months or more to receive in individuals who are 65 years of age or older, or those between 18 and 64 who are at a high risk if they do get infected to have a severe disease. That's mostly people with underlying conditions, and also people who are 18 to 64 who by occupational or institutional exposure, they may be at a higher risk for exposure. The proposal was to see if we can get third shot boosters for virtually everybody down to 16. The advisory committee to our regulatory agency voted against that and was a bit more conservative and allowed boosters for the groups that I just mentioned a moment ago.
What about the increasing evidence that suggests that your booster shot should be mixed and matched? So you should change the vaccine that you have for your third shot. What do you think of that research and that evidence that's emerging?
Well, we are conducting that research here in my institute at the National Institute of Allergy and Infectious Diseases. It's a three-part component where you take individuals who have been vaccinated either with Pfizer or Moderna or J&J, and you boost them first with Moderna on each of those, or J&J, or Moderna. And what you have is essentially a grid of 9 possibilities. The first group, which received a Moderna boost following the primary vaccination with either Moderna, Pfizer, or J&J, that looked good. That showed to be safe, to induce a good immune response, and those data are already recently been published. The next set will come out in the next few weeks. So hopefully, by the time we get into the mid to late fall, into October sometime, we'll have enough information to see if we can do that mix and match that you mentioned.
Do you think that these boosters could in any way help mitigate the millions who are choosing not to get vaccinated, though, as winter comes?
Well, we hope so. We hope we can do anything possible and everything possible to get people to be vaccinated, for the reason that no matter what season it is, if you are vulnerable and unprotected, that's not good. And that could lead to the propagation of the outbreak that we just discussed. But we feel as we get into the winter, even more so wanting to get people vaccinated, including getting vaccinated with the flu vaccine. Because when you get into the winter, you get people who are indoors. It's much more likely for a respiratory infection to spread. And you have the complication of other co-circulating respiratory illnesses, such as influenza. So if ever there was a time to get a COVID-19 vaccine, it's right now, before we get into the colder months of the late fall and the early winter.
And Dr. Fauci, what do you say to medical teams and ICUs across the country now who have been through so much, who have been on their knees, now looking at the rates going up, thinking about what's ahead, feeling a bit broken, I guess? What message would you have for them?
Well, first of all, they are truly the heroes and the heroines, and to just extend out to them how grateful our society is for the extraordinary effort that they put in, and to promise them that we will do everything possible to get people vaccinated. You know, these statistics that you mentioned, they are thoroughly avoidable. And we have the capability with our vaccine supply to be able to dramatically diminish infections, hospitalizations, and the 2,000 deaths a day that you're talking about. I mean, that just is something that should never happen.